All right, welcome everybody. I think we'll get started now. Thank you so much for joining us. My name's Laura Edgar. I'm a public health promoter at Huron-Perth Public Health. Today I'll just be addressing some housekeeping points and moderating the chat box. As you know, this webinar is being recorded for the benefit of those unable to make it today. We also have some time devoted at the end for questions. However, if there's something unclear during the presentation, let us know through the chat box and we'll try to address it immediately when we are able to. The speakers in our webinar will be Stefan Laras from the Ontario Fruit and Vegetables Growers Association, Christina Taylor from Huron-Perth Public Health, Jessica Van Geffen from Huron-Perth Public Health, Dave Whitney from Ministry of Labour, and Angela Willert from Huron-Perth Public Health. So welcome. Our webinar today is Prevent and Control Outbreaks, TFWs, Farms, and COVID-19. As a note, this presentation is delivered today, July 23rd, 2021. Information on this topic changes rapidly. If you're viewing this recording later, please be advised that we cannot guarantee this information is still accurate and complete as of the date of your viewing. For clarification of any of the points we talk about today, see the contact information below. We'll repeat this at the end of the presentation as well. What we're covering today will be an overview of the COVID-19 situation as it stands now, workplace safety, vaccine information, the Section 22 order, how to respond to symptoms to prevent an outbreak and control outbreaks, and then we'll open it up to questions from the group. So now I'll hand it over to Christina to get us started off.
Thanks so much, Laura. I wanted to take the opportunity to thank you today for attending to learn more about this very important topic. On behalf of Dr. Clausen and all the staff at HPPH, we thank you for the work you and your businesses do to put food on our tables and keep your employees safe. While this is a hopeful time, we still need to be cautious. COVID is not gone. We need to remain vigilant and continue with all our COVID public health measures as we continue to see activity to the north and east of our jurisdiction. This activity is largely due to a variant of concern known as the Delta variant. In particular, this variant is much more communicable than former strains, and it is also impacting those not yet vaccinated. As of today, Huron-Perth Public Health is reporting approximately 12 active cases of COVID. Our partner to the north, Grey Bruce Health Unit, is reporting over 140 active cases of COVID. So while we have seen activity slow in our area, we are still monitoring and we really need to keep those public health measures in place. Hence the presentation today. So again, thank you, and I hope you enjoy.
Thank you, Christina. So this will be a cue to Dave to start getting his slides shared.
Yeah, I'm Dave Whitney from the Ministry of Labour, Training and Skills Development, Regional Program Coordinator working out of London and Blue Water area. And basically I'm the technical advisor to the inspectors that we have in those units. So thank you for joining us today. The presentation that I'm about to give will provide you with some information and resources on what you need to know under the Occupational Health and Safety Act as it relates to COVID-19. I believe that if Stefan's on the line, as I go through this presentation, he may interject a few times just with some resources that his group has available to support some of the mandate that we have when we're out there inspecting and enforcing. So feel free to jump in, Stefan, as you see fit.
Will do. Thanks, David.
So today we'll take a look at why the Ministry of Labour might be visiting you, overview of responsibilities of the workplace parties, COVID-19 in the workplaces, and at the end of this presentation, there's numerous resources. And what I'll probably do is, Angela, send you this slide deck I think I have already, so I don't know if your plans are to share it with the group so that they have those resources, but we do have numerous resources available that should help you in your compliance with respect to COVID-19. Before we begin, it's important to note that this presentation is intended to be a resource and does not replace the Occupational Health and Safety Act and should not be used or considered as legal advice. As Laura has already said, one of the huge challenges through this pandemic period is just the fact that the legislation is constantly changing, and being on top of that and what the expectations are has been a challenge for everybody. So what's in this presentation today, it's no guarantee that it will be applicable tomorrow. I will, however, say that our core enforcement areas around COVID-19 have remained fairly consistent. So the Ministry's Occupational Health and Safety mandate is to set, communicate, and enforce the Occupational Health and Safety Act and its regulations. So the Occupational Health and Safety Act sets out a number of powers, requirements, and rights for workplace health and safety. So this includes duties of the workplace parties. In your case, as employers, that would be covered under Section 25 of the Occupational Health and Safety Act. Supervisors, the duties of supervisors under the Act are covered under Section 27. So the Occupational Health and Safety Act lays this out very explicitly, what the duties are of the various workplace parties, including workers. Workplace rights and responsibilities for workers. You'll hear me talk more about that. Requirements to establish joint health and safety committees or health and safety representatives if necessary. With respect to farms, committees are required under specific commodity groups, and I'll highlight that in a future slide. Requirements to address workplace violence and harassment. Authority to make regulations which detail how the general occupational health and safety duty should be carried out. So there's numerous regulations under the Act. There's a WMIS regulation, for example. There's a regulation for confined spaces. There's a regulation dealing with controlled biological and hazardous materials. So numerous regulations that our inspectors are also out there enforcing. Prohibiting reprisal against workers by employers, providing for enforcement by inspectors, and establishing offenses and penalties for non-compliance. So why might the Ministry of Labor come knocking at your door? Well, there's numerous reasons that we might show up at your workplace. First of all, we spend a lot of our time doing what we call proactive inspections. And that can include initiatives, campaigns, various blitzes. This time of year, for example, we've traditionally done blitz for new and young workers. So we are discussing with employers as students come in to their workplaces, for example, the steps that they should be taking to ensure that those young people, those students are safe, because a lot of times it's the first time that they've ever been on a job site. We do blitzes around known industry hazards, for example, falls from heights or machine guarding, that sort of thing. We may also attend your workplace in what we refer to as a reactive capacity. So that can be to investigate a critical injury or a non-critical injury or a fatality, heaven forbid, complaints that we receive through our contact center, which in fact is the majority of the work that we're doing out there is responding to complaints. Work refusals, every worker under the Occupational Health and Safety Act has the right to refuse unsafe work. Occupational illnesses, which has certainly been a huge factor through the pandemic period, and referrals from other agencies. We quite often get referrals from the public health units, from our federal counterparts, from groups like Electrical Safety Authority, etc. So I want to talk briefly about the powers of inspectors. The role of an inspector is to enforce the Occupational Health and Safety Act and its regulations. So the Ministry of Labor Health Inspectors, as part of their core enforcement duties, have broad powers. They have the power to enter any provincially regulated workplace without appointment, a warrant or notice to inspect for compliance with the Occupational Health and Safety Act. They have the power to handle, use, or test any piece of equipment, machinery, material, or agent in the workplace, and to take away samples if we deem that to be necessary. We have the power to look at documents or records and take copies of such documents away from the workplace. We have the power to photograph, to question or talk to any person that we deem necessary in the course of our inspection or investigation, and to order compliance with the Occupational Health and Safety Act and its regulations. And therein is one of the key things that employers is under our enforcement mandate could expect, if in fact there are contraventions, that there would be orders to correct those contraventions. It should be noted that our inspectors may also provide compliance assistance to workplaces and or refer workplaces to their relevant health and safety association for support in complying and ensuring that you're up to speed with your health and safety program at your workplace. And I know our inspectors, they really take a lot of pride in being out there, not only in enforcing, but doing everything they can to assist employers in complying. But we do come up short. We do have to draw the line at telling you specifically how to comply, because there are some legal issues with that. So we will give you assistance, point you in the right direction. We may not specifically tell you how to guard a machine, for example. Also very important when we're dealing with the agricultural sector, and our inspectors are very aware of this. You know, as I had stated in the previous slide, our visits are typically unannounced. However, before we enter into a workplace in the agricultural sector, our inspectors will typically contact the employer to inquire about any biosecurity protocols and outbreak status. And we are real sticklers about this. We understand the importance of that. And believe me, we do not want to be the agency that's responsible for spreading some type of bio disease between farms. So it is something that we take very seriously. Speaking on employer duties, so you heard me mention this, that's covered under Section 25 of the Occupational Health and Safety Act. So yes, employers do have duties under the Act, all aimed at protecting their workers from hazards in the workplace, and in this case, including infectious diseases like COVID-19. So in a nutshell, some of the key duties: take every precaution reasonable in the circumstance to protect workers. That's a very broad statement, but that is one of the duties, and specifically our inspectors will write orders to that duty around the specific hazard that they're seeing. Ensure workers have, ensure workers know about hazards by providing information and instruction to supervision. We believe that the workplace parties are the experts in the workplace at knowing what is hazardous in the workplace, and it is the expectation that as employers that you're informing those workers about the hazards that are present and the measures and procedures that you've put in place to mitigate those. Ensuring that supervisors know what is required to protect workers' health and safety on the job. Creating workplace health and safety policies and procedures. Ensuring workplace parties follow the law and the workplace health and safety policies and procedures that you establish. And ensuring that workers wear the right protective equipment and that they're trained to use it properly. So a physical inspection under COVID-19, what does that typically look like? What is it that we have been focusing on? So as I said earlier in my presentation, there's been some core things that have been consistent throughout this pandemic that we've looked at, all under this guise, for the most part, of reasonable precautions to protect workers. So with respect to masking requirements for staff, source control, and any other required PPE. Right now, eye protection also is required if a worker is working within 2 meters of another person and not protected by a barrier. If there's an active outbreak, for example, masking and eye protection should be required at all times, because that would be considered a reasonable precaution in that particular circumstance. Engineering controls, including protective barriers for workers in specific settings, such as kitchens, reception areas. We quite often see them in lunchrooms or in smoking areas. Physical distance requirements. So that has been one of the most prevalent things that we have tried to reinforce, the need to keep that physical distancing in the workplace. Also, we expect to see signs and visual cues to remind workers of the importance of that. Sometimes the markings on the floor, chairs in the lunchroom arranged in such a manner that people are physically distanced. We encourage employers to consider how they're physically distancing in the workplace, and not only have to consider it and put those measures in place, but monitor it and enforce it. And quite frankly, that's a lot of times what we see. Employers have done a great job in outlining these policies, outlining these procedures or measures that they put in place. Sometimes, though, we find that if it's out of sight, out of mind, workers aren't being reminded, it's not being enforced or monitored, that sometimes that's where we have that failure to physically distance. Cleaning and disinfecting, and of course, the WSPS issues around that. If you're using WSPS-controlled products, to make sure that people are using it properly, are using the proper protective equipment when applying it. Worker supervision and awareness training under the Occupational Health and Safety Act. We do look that every worker and every supervisor has undergone that training. That is, in fact, a free resource that's offered by the Ministry of Labor. And screening requirements. Passive screening for guests, patrons, and active screening for workers and essential visitors is the standard that we've been applying. So I want to talk briefly about worker rights, also entrenched in the Occupational Health and Safety Act. Every worker has the right to know about the hazards that they're being exposed to in the workplace. As I mentioned earlier, that's an employer's duty to make sure that workers are trained in those hazards. Every worker has the right to refuse unsafe work. There's a very specific process that's outlined in the Occupational Health and Safety Act from Section 43 to 50 that details that right to refuse unsafe work and the process that you must take. Every worker has the right to participate in identifying and resolving health and safety issues. And most of that participation comes through their participation in a joint health and safety committee, or in selecting a worker health and safety rep, for example, and having that person that will represent their safety interests in the workplace. Joint health and safety committees and health and safety reps. Only farms falling under 6 specific commodity groups are required to have joint health and safety committees when they have 20 or more regularly employed workers. And they're listed at the top there: mushroom farms, greenhouse, dairy, hog, cattle, and poultry. A farm operation associated with any unspecified commodity group. So for example, if it's strictly a cash crop farm of some type, there is no requirement for a joint health and safety committee, but you would need a health and safety rep if you have over 5 workers on that farm. Certified joint health and safety committee members are only required in those specified commodity groups if in fact you have 50 or more regularly employed workers. So In developing your COVID-19 workplace safety plan, this is a requirement under the Reopening Ontario Act. We certainly look at the elements of that safety plan individually as part of our inspections. We do not enforce that you actually have a safety plan for COVID-19. That actually comes through the Reopening Ontario Act. But we have done our part to help employers with that process. In fact, on our Ministry of Labor website, you'll find a toolkit to develop that safety plan. It contains a number of helpful templates. It gives you a COVID-19 safety checklist that you can refer to. The safety plan needs to describe the measures and procedures which have been or will be implemented in the business to reduce the risk of transmission of COVID-19 in the workplace. It includes measures such as screening, physical distancing, mask or face covering, cleaning and disinfecting surfaces, and objects, and the wearing of personal protective equipment. A lot of the things that you heard me speak about that we focus on when we're doing our inspections. The safety plan has to be in writing. It has to be available for review on request. The person that's responsible for the business has to ensure that a copy of the safety plan is posted in a conspicuous location of the workplace. So what if a worker tests positive for COVID-19? So under Section 52.2 of the Occupational Health and Safety Act, if an employer is advised that a worker has an occupational illness due to an exposure at the workplace, or that a claim has been filed with WSIB, the employer is required to notify the ministry in writing within 4 days. To make that reporting easier, we've set up an email box specifically to take those occupational illness notices. As far as what needs to be in that notice, the information that we're looking for is the name and address of you, the employer, a description of the occupational illness and what may have caused it, the period when the worker was affected, the name and address of the worker affected, the name and address of the physician or other medical practitioner, and the steps taken to prevent further illness. The employer is required to have a policy in place to address how to handle workers who have tested positive. This includes advising anyone with symptoms of a respiratory illness to remain at home. Decisions about when isolation can end are to be made in consultation with the public health authorities, not with the Ministry of Labor. We really can't advise you on that. You're best to reach out and have that conversation with your public health unit. Employers should assess the infected employee's past actions and potential contacts to close off their work area or the bathroom that they used, for example, and have it disinfected. I'm sure by now you're all very used to hearing the term contact tracing. Also, employers should identify who the infected individual may have come into contact with. And again, we would advise that that's something that you would do in consultation with your public health unit. The employer must inform their workers that the exposure has taken place. This generally takes the form of a date and time that the exposure took place, where it took place, but it doesn't include you divulging that person or that infected person's name. That's considered confidential medical information. So yes, letting your workers know that exposure has taken place in the workplace, generally the area, date and time, you fulfilled your obligations under the Occupational Health and Safety Act. So the real takeaway message from this slide is that this requirement is above and beyond any requirements to report to any other governing body, including the public health units and WSIB. So you're gonna be reporting this in all likeliness to those agencies, but you also have to notify us. And typically, the response that we're going to have is to come out and visit and make sure that you have those appropriate measures in place and that you are working in consultation with your public health unit. So we have been doing our best to reach out to the agriculture employers within our various regions. We've actually run two different initiatives that we call temporary foreign agricultural workers initiatives. So we basically get the information of which farms are employing temporary foreign workers, and we go out there and visit those farms with a focus on the measures in place to prevent the spread of COVID-19. We've really strived to offer education and compliance assistance during those visits. That's been our main focus, and to make sure that you folks have the information you need. Just to give you a very basic idea of what we've been doing through the course of this pandemic, under these initiatives, we've conducted 458 field visits to 400 different workplaces. We've issued 236 orders. In some cases, we've issued a few tickets. That usually occurs because of ongoing non-compliance issues. The types of orders that we have been issuing have been around physical distancing, masking, the screening measures that the employers put in place, information and instruction to workers about the measures that you have put in place to protect your workers from COVID, and cleaning and disinfecting. You can see down at the bottom, it's generally, we've conducted, around that 750 to 800 field visits within the farming sector throughout Ontario over the course of any year. You can see when we get up to 2020, that almost doubled, and that was directly related to the pandemic and the need that we felt to be out there to assist the agricultural employers and to make sure that these workers were protected. We are here to help. We do have an occupational health and safety contact center that is staffed 24 hours. I know it says Monday to Friday, 8:30 to 5 p.m., but you can call this number anytime, and we actually, it gets transferred to another agency that handles our off time calls, but we do take these calls at this 1-877-202 number at all times. If in fact you have a critical injury, a fatality, a work refusal, if your workers feel the need to complain about something, this is the means by which you will get our attention, is to contact our contact center. Our contact center is also staffed with specialists that can answer questions related to occupational health and safety. They're very knowledgeable people and very helpful people. So if you do have a concern or question, you can contact our contact center. At the end of my presentation, I said that there's all sorts of different resources that the Ministry of Labour has published in consultation with our other partners. A lot of these come from Public Health Ontario, for example, but are available also through our website. So all sorts of posters, printable posters related to different aspects of COVID-19. Excuse me. Other online resources, sometimes in multiple languages, realizing that many of these temporary foreign workers, English is not a first language. So yes, we have multiple resources in different languages.
We'll send these to all the people who registered, and these presentations should be available on our website on the TFW page sometime next week as well with the recording. Thank you.
This may be where Stefan wants to jump in. There is a COVID-19 agricultural resource library, and I understand that his agency had a lot to do with that. So Stefan, if you would like to say a few words about that.
Yeah, thanks, David. And hi, everyone. I think I wanted to kind of dovetail on what David said, which is like the requirements. And I wanted to highlight kind of on the resources that growers have and producers have to actually do the things that Ministry of Labour is asking for. So why don't we get to it? I'll try to get my screen up here. There we go. So a couple of things I wanted to share. Can everyone see my screen here? I'll try to make it full. Here we go. So really, like David was talking about all the things that growers really need to be mindful of. And I think from an Open VGA perspective, we often hear that growers like they want to do all the things that that are expected of them, but it's really difficult. You don't necessarily know what you need to know. So WSPS, which is the Workplace Safety and Prevention Services, has been basically provided with funding by OMAFRA to essentially make their services free by virtue of OMAFRA paying up front, basically, make their services free for producers to access their services. So it's a prepaid arrangement up to $2,000 in free consultation support. If you're looking for basically hands-on and technical advice from someone who deals with workplace safety, that's, I would say, $2,000 worth of value that you can access on that website. So the link is there. I would encourage growers to use it. We did a webinar earlier in, I want to say, January, February, where we talked about these available resources. There was, about half of the participants hadn't heard about these resources. So I'm going to go out on a limb, say that if you don't know about these resources, don't feel like you've been living under a rock. It's just there's a lot of information out there, and that's why we're talking about this. These programs are legit. They're not necessarily at this point fully mature to the point where all your neighbors will have done it, but everyone that I've talked to at this point has seen value once they've actually gone down that road. So the $2,000 worth of consultation at this website, and we'll make that available after the webinar. And the other one is up to $5,000 worth of WSIB premium rebates. So whatever your current contribution is to WSIB, you will know your number better than me. If you have a $100,000 payroll, then 2% of that will be $2,000. So you can get, if you have a $500,000 payroll and you would have roughly maybe $10,000 WSIB premium, you'd be able to get $5,000 up to $5,000 in rebates if you follow the health and safety program. And again, I've talked to growers that have gone through it. It's not like effortless, but it's also not overly complicated. So the one thing I wanted to point out is that WSPS with the free consultation will actually hold your hand somewhat into the WSIB Health and Safety Excellence. So if there's one thing I'd like to take people to take away is that contact WSPS, and ideally you get essentially $7,000, so $2,000 plus $5,000 worth of value from that phone call that you make. And the other thing I wanted to point out, David talked about having everything in place, like having your I's dotted and your T's crossed. There are some ready off-the-shelf policy templates if you need HR policies. They're available at the website above, like that you can see here, the HR Toolkit, provided by the Canadian Agricultural Human Resource Council. I think OFA is a member, OFMVGA is not, but Farms is. So if you're a member of OFA or Farms, you can contact that office and they will give you free access. There's a code that you need, but you can get it, and just contact your office and get the code, and you can access, I think, up to, I want to say, 20 or so policy templates that you don't have to create from scratch or pay a consultant for. Okay, and the last thing that David pointed out was getting your workers up to speed on what they're obliged to do. There's a lot of resources out there. What we really tried to do at OFMVGA was develop resources that will resonate with workers. So we kind of worked with cultural liaisons that work with these workers, like that interact with them regularly, and we customized the resources that are generated by the government. We customized them to the understanding, the comprehension and education level of the workers, because that's important. They need to feel like the resources are meaningful and speak their language and that they're comprehensible. So the resources that we ended up adopting from all the government resources are on the link that you see below. Basically, we'll get into vaccination later, but everything that David mentioned, like hand hygiene and just about everything, is available in poster format. in the language English and Spanish and Thai. So if you feel if you feel like you need to up your game on educating the workers or providing them with information, that's a good resource. Finally, I wanted to point out, if you are doing daily screening by paper, OFMEGA is currently offering free phone-based services to do the screening. If the workers have phones, you can sign up for free and get your workers to submit their daily screening before they even get to work every day. So that is also on the same website that you see below. And I think that was one of the requirements that David mentioned under the Reopening Ontario Act. So with that, I'll go back to David.
All right, and David, if you were pretty well wrapped up, I know we're running a little short on time already.
I am.
Are there any last points you needed to make?
No, I am wrapped up. If anybody has any questions, I'm happy to answer. Other than that, have completed my presentation.
All right, and maybe put them into the chat box for now. And as I did note to the participants, we're running a little behind, and we may go past 2. If you need to leave at 2, I understand. We'll continue to go on and record, and you can catch what you've missed later. But hopefully you can join us, because we'd love to have you around and for your questions. So the next section is on vaccines.
Thank you, Laura. Can I just confirm you can see my screen there?
Yes, I can.
Awesome. So I'll jump right in. So what we have, I'm just going to give you a bit of an update on the vaccine front for here in Perth Public Health. Right now, HPPH is administering both Pfizer and Moderna. However, due to supply, predominantly we're administering Pfizer at most of our mass vaccination clinics. I have a few slides prepared for you, but really want this to be a takeaway for you as well. So on each slide, I've provided a few helpful links that either link to things on our Here in Perth Public Health website or Ministry of Health or the Government of Ontario's website, so that you can grab more information as you go. So when asking where to get a vaccine, either for yourself or your workers, you can book into one of our mass vaccination clinics. We have clinics that will shortly be released on our website that will lead us up until August 14th. You can book online. I've included our booking number here, or you could email COVID scheduling. We have been seeing a number of TFWs come through our clinic, and you also have the opportunity, if you call us or email us, we can book groups into our clinic. We're happy to do on-site translation, video translation. We have select paperwork translated into different languages, so we can absolutely accommodate whatever comes through our clinic. And again, have provided some helpful links there so you can click through and find where to book. We also have a number of pharmacies across Huron and Perth that offer vaccine administration. So not knowing exactly where everyone's coming from, I've included our link there as well so you can click through and see what's close to you. And just some other things to keep in mind. Like I mentioned, we can make it a pretty simple process for you guys. We can book groups in. We have on-demand translation. We often get the question, is an OHIP number required? The answer is no, we don't require an OHIP number. Sometimes if they have a passport or driver's license, we can enter that into our provincial system just so that we can link medical records. However, if they have absolutely nothing, we will make do. We would prefer if they had some kind of ID that could validate they are who they are, but we'll always work on the fly in the clinic to make sure everyone gets their vaccine. And of interest now, we are offering several walk-in clinics. So our website has the most up-to-date information, but definitely we are telling people if you need a first dose, show up to any clinic and we will make it happen. And I've included a link there if it's of interest to people on how you would register a vaccine if you've received one outside of Canada or Ontario. So that is our general website and intake line if you have any questions, and they can lead you through to booking. Thanks, Laura.
Thanks, Angela. Stefan, was there resources you could share with us now?
Yeah, I mean, I won't pretend that it's a game changer for farmers because basically where I'm going with the stuff that I'm going to put up is farmers do talk about how tough it is to get some of their workers convinced to take the vaccine. It's a free country, so it's up to them. And just trying to get my slide up. So really what I'm going to share with you is the resource that we've made available to growers and producers to help nudge workers towards being fully educated and fully informed of the benefits of vaccines and get them to that comfort level, because there's a lot of misconception out there. So hopefully, obviously your personal charm and convincing the workers will be the #1 tool, but let me just get where did it go?
I can see supports continued. Oh, testing pre-departure biosecurity signage. There we go, vaccine.
Vaccine. Okay, good. Yeah, so really I just want to point out, long story short, everyone's got their hands full with some, at least some producers have their hands full with workers that are reluctant to embrace the vaccine. This is another tool in your toolbox to share with the workers. You see the link there. It's basically information in English and in Spanish and in Thai that addresses some of those myths that are floating around that keep workers from taking their first dose and frankly their second dose as well in some cases, which is ironic. It's both in PDF format, so you can print it and give it to them, or you can share the link that you see the YouTube videos. Again, these are accessible through the main link that you see at the top of the page. Basically, the videos are a narrated version if the worker doesn't, if they don't have the reading capacity to read the PDFs or the interest. They can watch the narrated video of, it's basically the narrated version of the PDF poster. So again, it's a tool in the toolbox to hopefully get your workers vaccinated, because that's peace of mind for everyone. There is work underway. Ministry of Health has shared guidance on the second vaccination, like which vaccines can be safely paired. We are working, OFMEGA will be circulating a resource that is adapted for workers specifically, again, to help make them make a decision and get them across the finish line for second vaccinations. And we'll be circulating that and sharing that with Laura and her team as soon as it's done.
All right, thank you very much. If you guys have any questions about any things that have come up, feel free to put them in the chat at any time and we'll come back to them during the question period. So now I'm going to invite Jessica Van Geffen to share her slides, and I'm going to put up.
All right, Laura, can you see my screen?
I can.
And you can hear me loud and clear. Perfect.
Gorgeous. Thank you.
All right. So my name's Jessica. I'm a health inspector with Huron and Perth Public Health, and today I'm going to start off talking about our Section 22 order. So the Section 22 order, class order, first came out last year, actually June 30th, 2020. And what the Section 22 order does is it really gives a legal requirement for the farm to follow. And it lays out some of the requirements that we want the farm to follow. And it's there to help give direction to help eliminate problems. And we first issued it in June, like I said before, and then we reissued it and updated it on March 23rd, 2021. And it gives a legal requirement for what you need to do. And the sections that we have and who it was issued to, so we have it to any owners and operators of agri-farms in Huron and Perth counties that operate models of housing accommodations for domestic and or temporary foreign workers in Huron and Perth, and or employ temporary foreign workers in any capacity or participate in in the federal temporary foreign worker program in Huron and Perth. So there are different sections to the orders. There's development and submitting the following plans. So a COVID safety work plan and an arrival quarantine plan. And we want those within 4 weeks advance to the arrival of the temporary foreign workers. So as Dave mentioned earlier, the COVID-19 workplace safety plan is something that's required underneath the Reopening Ontario Act. But in the order, we've added some extra things that we need, and then we also want that submitted to the health unit. And some of the things that we have in there, so we want the standard stuff in there, but we also want details in there about daily active screening of workers at the beginning of the day. So we want that really detailed in there. We want regular wellness checks of workers in there, and we want details about how you're going to cohort workers to individual work sites, and that includes the separation of temporary foreign workers and the cohorting of temporary help agency workers as well, to the greatest extent possible. We also want, underneath that section of the workplace safety plan, the maintaining of a list of all workers and essential visitors that come onto the work site for the year, for the 2020 season, and that it can be produced and given to the health unit within 24 hours of being requested. And that would include names and telephone numbers and cohorting details. And this would be in case there was ever an outbreak that we could quickly do contact tracing and identify who would be high-risk contacts to a specific site. The COVID safety plan would also detail education of workers on the guidelines for public health measures related to COVID-19. We would also have detailed plans for notification for temporary foreign workers on how, if they become symptomatic, so how you're going to notify the health unit if anybody becomes symptomatic, and isolation and quarantine plans for any temporary foreign workers who are on site and any of their close contacts. So anybody that you provide housing, where you're going to isolate them if they become symptomatic or if they test positive. And then also a way for us to contact them. So a communication device and how we're going to be able to contact them. So either cell phones or landlines. So communication is really important when we're in an outbreak situation, that we're able to communicate with the workers. So having a communication plan is required, and that's part of your COVID's workplace safety plan. So then the arrival and quarantine plan is also required to be submitted to us as well prior to the arrival of your workers. The next part of the order is following all the requirements and lays out all the requirements for the 14-day quarantine. And that's laid out in the order as well. And then Part C of the order goes over the public health measures that must be followed. And this looks at informing the health unit of the arrival date and the number of workers that are coming once you know when they're coming, and letting us know when they're coming. Maintaining a list of all the workers and essential visitors that have come onto the farm within the 2020 season, including their names, telephone numbers, and cohorting details. Conducting active daily screening for symptoms and exposure history for COVID-19. We want to ensure that there's a variety of control measures implemented on the farm. So that includes physical distancing and barriers, increased ventilation, frequent cleaning and disinfecting of high-touch surfaces, source control masking, protective provisions for personal protective equipment, cohorting, and limiting work to one location at a time. When we're talking about the accommodations for the workers, we're looking for beds to be separated and spaced 2 meters apart from frame to frame. And if that can't be done, then there needs to be alternative strategies in place. And then there's other measures within this section as well. So that order's in place, and we've got various reasons for why the Section 22 order's in place. Now currently, oops, sorry about that, I jumped really quick. Currently, we're in the process of updating the order, and that will be coming out shortly. And there's just a few things that will be updated within that new order. And specifically, when we're talking about Section A, we're going to be looking at contact. So when we're talking about the cohorting, and that's with separating contract and or temporary help agency workers. When we're in Section C, so the health measures, we want the notification. We've added the notification to the health unit of symptomatic workers or workers tested for COVID-19. But you don't have to notify us of the day 8 tests that are required for federal quarantine. And we're adding the notification to the health unit of any positive COVID-19 test results. And there's also going to be some updating for the reasons for the order being issued.
Yes, I had a quick question come in too. When a new temporary foreign worker comes in and we're to notify the health unit, how should we be notifying them? Is it a specific email address or phone number?
So there is, so when a new worker comes in, there is notification on our website. If you go to our temporary foreign worker webpage, there is a form that can be completed and then you can submit that to us, or you can email ehresponse@hpph.ca and you can notify us that way, and then that can be sent to your area inspector.
Excellent. Thank you, Jess.
Not a problem. But there is a form on our website, and we can, Laura, can we send out that link?
Yes.
At the end to our website, because there is a form that can be completed on our website.
Yeah, we'll do that.
Perfect. So those are the areas that we're looking at updating on the order. And the other thing that we're discussing, and I don't know if it's going to be updated on the order, but knowing the vaccination status of the workers. And even if it doesn't get updated on the order, just knowing that information, because it would be a question that would come up in an outbreak situation. How many of the workers are vaccinated, and if they've received 1 or 2 shots, if they've gotten both, they're double vaccinated or not, would be a question that we would ask in an outbreak situation. So even if it's not in the order, knowing that information about your worker is really important. So that's about the order. Is there any other questions about the order? The order is posted on our website as well. So if you haven't by chance received a copy of it, we have emailed it out, but it is also posted on our website.
I did actually have one more question come in about notifying the health unit of a symptomatic worker or a positive test result. And maybe this is in what's coming up now, but how should businesses do that?
So that can be done. So if you have a symptomatic worker and it is coming up, you can actually, it's on the very first slide. So when we have a symptomatic worker, you can actually notify response. You can do that through a phone call is the best, because we want to know right away if you have that symptomatic worker. And so you can give us a call at the health unit and let us know through response, which is where you will get an inspector. So we have a public health inspector that's always working on that line. Traditionally, you'll leave a message, but they'll get it fairly quickly, and then we'll be able to respond right away so that we can start a process. Because we want to make sure that if you have a symptomatic worker, that we get them isolated right away, and that we ensure that we're testing them right away. And same thing with a positive worker. We want to make sure that we're isolating them right away. So that leads me right into the next part of the presentation. So if we've got a symptomatic worker, and this is really key, that we're screening and we're identifying the ill workers right away. It's key that we find these individuals right away. The earlier we're able to identify a sick worker, the quicker we're able to isolate and potentially reduce the amount of spread that occurs. I know from past experience that if we aren't able to that if the workers don't feel comfortable in telling you that they're ill, that it can lead to greater spread. So it's really important that employers reassure employees that they can tell them that they're sick. So I know with other outbreaks in other jurisdictions, it's been said several times that employees often feel of pay, or that they're concerned about loss of jobs, or so giving them that reassurance that they may not lose pay or that they're not going to lose their job, that it is really important that they share if they are feeling unwell. And so this is how we reduce the effect of an outbreak. So identifying an ill worker is key right away. So screening and active screening is really key. So having them fill out the screening tool and doing it active means having somebody review the screening tool and ensuring that the screening tool gets completed each day and catching if anybody is sick. And then ensuring that if anybody is sick, that they are isolated and tested, that the health unit is notified about any symptomatic workers, and that those symptomatic workers are tested. And that, as you can see here, I've got the number and the extensions that you can call. And that if anybody is really sick, that we do get them to seek medical attention right away. The other thing to remember is, I know that in some cases we've had in the past where individuals have said, well, I've just had a cold, or I just think it's a cold. And in this day and age, we really need to make sure that we get that test in so that we don't downplay COVID. I know with screening, there is a baseline of health that we can be looking at. So we all know if we've got allergies and things like that, but it's important that if it's something that's new and unusual for the individual's health, that we are sending them off for testing. So if we've got somebody that's gone off for testing and we've got a positive worker that's come back, and we've got some cases, this is what we could potentially be moving into an outbreak situation. So this is our definition for a farm outbreak. So if we have one confirmed case among a resident or of a congregate living setting associated with a farm, or if we have two confirmed cases in workers or any person working on or visiting a farm with an epidemiological link within a 14-day period where at least one case could have reasonably acquired their infection on a farm, then we'd be in an outbreak situation on a farm. So this is how we determine if we're in an outbreak on the farm. So when we're in an outbreak, what would we expect? So what we kind of need is an isolation space. So when we're talking about an isolation space for an individual, we're looking at a place where the person could isolate. They would have their room, they would have their own bathroom, and then they would either have their own kitchen to prepare their own food, or their food would be brought to them. So really they wouldn't be able to interact with others. We could potentially look at cohorting groups based on illness. And then the other thing that we're looking at doing when we're in an outbreak is having an outbreak management team. So this usually involves people from the health unit, and then we have a contact for the farm, and then we usually have people that provide supplies to the workers, and then there's somebody that is involved with communications. There's the person responsible for healthcare, and then people that are responsible for communicating with the media. If media gets involved, then sometimes media can get involved. And then we can also have people that can be involved with cleaning and disinfecting. So your housekeeping that can be involved. So there's lots of different people that can be on your outbreak team, but sometimes with farms, we can just have one person that's going to be running the whole show on this matter. And then the team that could be involved from the health unit could be your contact with the health unit and then case and contact team. So you could have a few people from the health unit involved as well. So with cohorting, we could be looking at cohorting groups of well individuals, and then you could have your ill individuals, so your positive cases, and then you could have your high-risk contacts that could be cohorted into living environments. Ideally, if we can have everybody isolated on their own, that's the best, but it depends on what we have arranged. And that's what we want to actually have planned ahead in our safety plan, in our COVID safety plan. So if we can plan all of this ahead, that's what we ideally want. And then we would hopefully just be opening up the book and going, okay, this is our isolation environment, and we're just going to roll everything into place. So the steps in the outbreak is we would be determining our isolation locations and where we're going to quarantine everybody if we're going to be cohorting people, and where we're going to be cohorting people and where we're going to be isolating people. We're going to be determining our contacts and identifying them, and that's where in our order we'd be asking for the list of who was on what location and where they were working and who was on the farm. So we'd be asking for that list of contacts that we required in the order. We would also be asking you to do daily health check-ins of your COVID cases and your high-risk cases, or your high-risk contacts, sorry. And we'd be ensuring access to services and support. So food being provided to those that are being isolated, any health supplies being provided, and we'd be ensuring that there's a testing plan in place, because high-risk contacts need testing done partway through isolation. So those are going to be the steps that will be happening throughout the outbreak. And then the question that always gets asked, usually right at the beginning, is when will this be over? Because everybody wants to get out of the outbreak. So the outbreak would be declared over after 14 days have passed with no evidence of ongoing transmission that could be reasonably related to an exposure in the workplace, or 14 days after the date when the outbreak measures were implemented. So the biggest thing is how can we prevent an outbreak from happening? There's no guarantee that we can ever prevent it. We can have all the measures in place that we possibly could.